Bladder cancer is a cancer that starts in the bladder. The bladder is the body part that holds and releases urine. It is in the center of the lower belly area. Bladder cancer symptoms. Symptoms of bladder cancer can include abdominal pain, blood in the urine, bone pain or tenderness, fatigue, painful urination, urinary frequency, urinary urgency, urine leakage, incontinence, weight loss. Note: other diseases and conditions can cause similar symptoms. It is important to see a doctor to rule out all other possible causes. Bladder cancer treatment. Treatment depends on the stage of the cancer, the severity of your symptoms, and your overall health. Stage 0 and 1 treatments. Surgery to remove the tumor without removing the rest of the bladder. Chemotherapy or immunotherapy directly into the bladder. Stage 2 and 3 treatments. Surgery to remove the entire bladder, radical cystectomy. Surgery to remove only part of the bladder, followed by radiation and chemotherapy. Chemotherapy to shrink the tumor before surgery. A combination of chemotherapy and radiation in patients who choose not to have surgery or who cannot have surgery. Most patients with stage 4 tumors cannot be cured, and surgery is not appropriate. In these patients, chemotherapy is often considered. Chemotherapy. Chemotherapy may be given to patients with stage 2 and 3 disease either before or after surgery to help prevent the tumor from returning. For early disease, stages 0 and 1, chemotherapy is usually given directly into the bladder. A Foley catheter can be used to deliver the medication into the bladder. Common side effects include bladder wall irritation and pain when urinating. For more advanced stages, 2 to 4, chemotherapy is usually given by vein, intravenously. Immunotherapy. Bladder cancers are often treated with immunotherapy. In this treatment, a medication triggers your immune system to attack and kill the cancer cells. Immunotherapy for bladder cancer is usually performed using the bacillus-calmette-guerin vaccine, commonly known as BCG. It is given through a Foley catheter directly into the bladder. If BCG does not work, patients may receive interferon. As with all treatments, side effects are possible. Ask your doctor what side effects you might expect, and what to do if they occur. Surgery. Surgery for bladder cancer includes transurethral resection of the bladder, TURB. Cancerous bladder tissue is removed through the urethra, partial or complete removal of the bladder. Many people with stage 2 or 3 bladder cancer may need to have their bladder removed, radical cystectomy. Sometimes only part of the bladder is removed. Radiation and chemotherapy is usually given after this surgery. Surgery may also be done to help your body drain urine after the bladder is removed. This may include ileal conduit. A small urine reservoir is surgically created from a small piece of your bowel. The ureters that drain urine from the kidneys are attached to one end of the bowel segment. The other end is brought out through an opening in the skin, a stoma. The stoma allows the patient to drain the collected urine out of the reservoir, colon and urinary reservoir. A pouch to collect urine is created inside your body, using a piece of your colon. You will need to insert a tube into an opening in your skin, stoma, into this pouch to drain the urine. Orthotopic net bladder. This surgery is becoming more common in patients who had their bladder removed. A part of your bowel is folded over to make a pouch that collects urine. It is attached to the place in the body where the urine normally empties from the bladder. This procedure allows you to maintain some normal urinary control. Bladder cancer is a common disease, yet every individual needs unique treatment and care. We encourage people with bladder cancer and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about bladder cancer and how to treat bladder cancer, just click on the link at description or visit www.mainmd.com. Thank you.